Hello, my name is Tabitha Shah and I'm a student at Grand Canyon University. And today we're actually going to be going over Staphylococcus, an overview of bacteria and its impact. Now, in this picture right here, you do see that Staphylococcus is going to be circular in shape, and that's something I would like you to remember as we go on through this PowerPoint. So today we're going to begin about what exactly is Staphylococcus. Now, you may actually know Staphylococcus by its normal name that we use commonly, known as staph infection. Now, you may have had a staph infection in the past, and there's actually going to be a story that I would like to share with you guys regarding my own staph infection experiences. Now, a little bit about Staphylococcus. Now, Staphylococcus is a type of bacteria, so we're not working with viruses, we're working with bacteria, and it tends to be round in shape. Now, if you look at this picture right over here, you can tell that they are spherical, or they are round in shape, and they do like to cluster together. Now, Staphylococcus aureus is going to be your most well-known and clinically significant type of strain of Staphylococcus. Now, what I mean by that is most staph infections are caused by Staphylococcus aureus, and we're going to focus on that today. There is an importance of why we actually study it in microbiology. Staphylococcus is actually one of the #1 reasons that people get skin infections. And because it has such a high number of skin infections, it's really important to understand it and to really know what staph infection is capable of and how to overcome it. And this is going to help in the development of diagnostic tools and treatments for patients. Now, relevance in medicine, like we mentioned earlier, S. aureus is going to be responsible for many different types of infections, ranging from pneumonia to your common skin infection and things like that. Now, there is a rising prevalence of antibiotic strains of S. aureus, and we're actually going to talk a little bit about that more later on in our PowerPoint. So before we begin talking a little bit more about the structure of Staphylococcus and what it causes, let's talk a little bit more about its history. So it was actually discovered in 1880s by this man, Sir Alexander Ogston, and he was actually a bacteriologist, which means that he primarily studied bacteria. Now, he did identify Staphylococcus aureus back in the 1800s, and this laid the foundation for a lot of different types of infections that are bacterial infections for studying. Now, he paved the way for future research on bacterial pathogens, and he actually was the launching start for different treatments for Staphylococcus. So let's actually talk about its taxonomy. Now, Staphylococcus belongs in the domain bacteria, which represents the largest group of living organisms characterized by prokaryotic cell structures. Now, I am a high school teacher, which means I like teaching my kids no nucleus, which means that it's a very simplistic structure of a bacteria. Its kingdom is going to be bacteria, which includes all true bacteria, which are single-celled organisms. Its phylum is going to be Firmicutes, comprised of bacteria with thick cell walls, and they're often gram-positive. And in this case, Staphylococcus aureus is going to be gram-positive. Its class is Bacilli, a class that includes rod-shaped bacteria. However, Staphylococcus is cocci in shape, which means that it's circular in shape. Its order is going to be Bacillus, which encompasses various bacteria, including those that are pathogenic. Its family is going to be Staphylococcus aureus. This family includes the genus Staphylococcus, characterized by its grape-like clusters. And in this picture right here, you can actually see how they like to cluster together. And if I put a little stem right here, it would actually look like a grape. And then its genus is going to be Staphylococcus. A genus is the bacteria known for its pathogenic potential and ability to cause infection. And its species is going to be S. aureus. That is the species that we're going to focus on today during this presentation. And the reason we're going to focus on this today is because this is going to be the most clinically significant species associated with a wide range of infections in humans. Now, in this next slide right here, we are going to see the structure of Staphylococcus. Now, in this image, I do want you to take note that we are still talking about that circular shape, so that cockeye shape, and Staphylococcus is going to be gram-positive bacteria. Now, in most cases, gram-positive bacteria tends to be less antibiotic resistant, which means that it tends to be easily cured or treated. Now, like we mentioned earlier, we do like to see that Staphylococcus likes to kind of gather together to form little grape-like structures. And like we mentioned, it does have a thick peptidoglycan layer. And this picture right here, you can actually see that that layer is going to be that yellow wall all the way around. So the real question is, how do you actually get a staph infection? Well, here is the most common way that most people get staph infections. The first thing is you have to make some type of direct contact with a surface or with another person that has the bacteria. And then it adheres to the host. After it adheres to the host, it's going to start its production of toxins and enzymes, which is going to start an invasion of the host's immune response. Now, most of the time when you come into contact with Staphylococcus, it will cause various skin infections, but it can also cause things like pneumonia. And in really bad cases, it can cause things like sepsis, which is deadly. Now, the reason that I like to focus on Staphylococcus is not just on my own personal experience, but also this is going to be a very prevalent infection throughout the world. In fact, it's found all around the world, and it's actually one of the most common reasons for infections in hospitals. So there is something called MRSA, which you may have heard of in the past. And MRSA is actually a type of Staphylococcus aureus. And we're going to go a little bit more into detail later on about MRSA. But just know that MRSA is very common in hospitals and it can cause a lot of havoc. Now, like we mentioned earlier, transmission is going to be caused by direct contact. So making direct contact with something that is infected or something that has the bacteria, whether that's making direct contact with somebody or grabbing an item that is going to be contaminated. Some risk factors, of course, are going to be having like poor hygiene. And as a high school teacher, one of the largest places that you can find staph infections, or at least the staph bacteria, is going to be in locker rooms. Every year I have my students do swabs, and a lot of the times kids will go in and swab the locker room, and we start growing Staphylococcus in our incubator. So risk factors are going to be poor hygiene. Another really big risk factor is going to be open wounds. In fact, Staphylococcus is the #1 type of infection for burn victims. So burn victims, they already have an open wound, their skin is trying to heal, but during that time, they are more susceptible of developing staph infections, which can lead to sepsis. And then, of course, having a weakened immune system will always increase your chances of developing an infection. So here we are, finally to my story. So let me give you guys a little bit of a background, and then I'll start talking about this image right here. So back in 2022, I actually went on a vacation with my family during spring break. And actually, tomorrow will be my 2nd-year anniversary from recovering from my staph infection. So, background. I went to San Antonio, and while I was in San Antonio, my family visited our favorite place to go. We went to SeaWorld. And at SeaWorld, there is one water ride. And I love this water ride to death. I go on it every time we go to SeaWorld. And occasionally, some water will land in your ear. Nothing crazy, but this time was a little bit different. So I went on this roller coaster, water ride. We went down, water came splashing up, and a tiny bit of water actually went into my ear. Didn't think anything of it. I kind of brushed it away, went on with my day. 3 days later, we're on our way back to El Paso, Texas, and I start feeling a little bit sick. So I start having headaches. I feel a little bit of pressure on the back of my ear. Nothing too crazy, but then the pain started to get worse. Now, my first thought was, man, I just developed a outer ear infection. Why did I think outer ear infection? Well, outer ear infections are the most common type of ear infections. And I've had many outer ear infections, especially as a kid who suffers from allergies. I'm very well known to get outer ear infections. Now, in this picture in the middle, this is what your ears should normally look like. Should have a clear passageway, but during the outer ear infection, everything in red is usually going to be bacteria or some type of irritant that makes the canal a little bit more narrow. Now, if you have bacteria growing, sometimes you might have a little bit of leakage, you might have pain, you might have swelling of the lymph node, things like that. But what I didn't know is that I actually had developed a middle ear infection. Now, middle ear infections are a little bit different because instead of being in the outer part of the ear in your ear canal, they're actually inside of it. So this actually goes on with my story about what MRSA is. So before I continue my story, let me give you guys some background about MRSA. That way we kind of know what we're talking about as I go through my story. So MRSA is a type of a Staphylococcus aureus. It's still Staphylococcus aureus, but the biggest reason that it is categorized differently is because it's going to be highly antibiotic resistant. So we have the same species, but one of them has acquired resistance to antibiotics. Now, this can cause a lot of havoc, especially in hospitals, because usually when you come into the hospital, they like to treat you with general antibiotics, so things like penicillin. And most of the time, penicillin will work, or methicillin will work as well. But in this case, MRSA is not susceptible to the antibiotics. It's actually resistant to those antibiotics. Now, a little bit of background. According to the CDC, 1 in 3 people will develop Staphylococcus. That's a pretty high number. That means if you have some type of skin infection, 1 out of 3 people will have Staphylococcus. But MRSA is more rare. In fact, 1 in 50 people will carry MRSA. So that is a very big difference. 33% versus your 0.02%. So back to my story. So, like I told you guys earlier, I developed a middle ear infection. And everything in the red right here was actually bacteria forming inside of my ear. And if we were to do scans, this is what it actually would have looked like. It would have just been bacteria floating inside of my ear canal. Now, this is how my day progressed. So I was coming back from the trip, was having some ear pain. It started to get a little bit worse. I decided to go to an urgent care clinic because they tend to be a lot faster than hospitals. So I went to the urgent care clinic and they gave me some prescription antibiotic eardrops. And the idea was for 5 days, I was supposed to tilt my head, put some eardrops, make sure my head is tilted for about 10 minutes, and then it would drain and get rid of all the bacteria. So that's how it's supposed to work. And the antibiotic that I was prescribed was methicillin, which is going to be a very common type of antibiotic, especially for ear infections. Now, 5 days passed. I made sure that I took my medication exactly when I was supposed to. But the issue was my ear wasn't getting better. In fact, it was getting a lot worse. It was getting worse to the point that I actually had pus draining from my ear. And what I mean by draining is I had multiple towels that I was getting soaked in pus within an hour. And so after the 5 days, wasn't getting better, started to get in a lot of pain. I ended up going back to the hospital. Now, here's how standard treatment goes. When you go to the hospital, the first thing that they'll do is they test you to see if you are working with an antibiotic resistant strain or if the bacteria that you have is antibiotic susceptible. Because if it's antibiotic susceptible, different medication like methicillin is going to work beautifully. Penicillin is going to work beautifully. But in the rare cases that you have an antibiotic resistant strain like MRSA, then you have to use antibiotics like linezolid. But these type of antibiotics are not commonly prescribed to people who don't need them because we are trying to avoid making bacteria come into contact with these type of antibiotics to reduce the chances of them becoming antibiotic resistant just from overusage. Now, the way that they test for antibiotic resistance is you go in and they'll do something called a blood culture, which means that they take out blood from your veins and they put them into these bottles. One bottle is going to be anaerobic, while the other bottle is going to be aerobic. And the idea is we're going to take that blood and then we're going to start culturing the bacteria. Now, the problem is when you culture bacteria, it does take a couple of days. I don't mean like one day. I mean, it could take 3 to 7 days to start growing that bacteria. Now, during that time, they will go through regular treatment and they will provide you with common antibiotics like penicillin. Now, who should get a blood culture test? Well, any patient that has fever or chills, or if you have a high number of white blood cells, or if you might be going into septic shock, they will immediately do a blood culture test. Now, like I said, it does take a couple of days. So during this time, I was in the hospital, and for 4 days, I was receiving common antibiotics through IV, like penicillin. And the issue was my bacterial infection wasn't getting any better. Now, this picture is a picture of what a normal middle ear should look like. So it should be clear, you should be able to see the structures, but as they were doing CT scans on my ears, they were able to see that there was a ton of fluid buildup and that there was bacteria being built up inside of my tube. And at this point, antibiotics weren't working really well. And it wasn't until we got my blood culture back that they found out that they were actually not working with S. aureus, that is usually antibiotic susceptible. We were working with MRSA, which is type of an S. aureus, but is antibiotic resistant. So immediately they removed me from the penicillin and they started to give me a type of antibiotic that was meant to treat MRSA. But at this point, it was a little too late. The bacteria had started to travel through my bloodstream and it was making its way to my brain. Now, most of the times when you have a really bad ear infection, they go in and they place a tube. And this tube is going to allow your ear to drain and it's going to get rid of the infection. Now, this is how my treatment was going to go as well. But because it had started traveling to my brain, I started to develop really high fevers and they were afraid that I was going to die. So what they ended up doing is they ended up doing this middle ear treatment where they did install a tube, but it wasn't just one tube, it was actually 2 tubes that they installed. So one tube is inside and then they had a drainage tube. And this tube right here, they actually started to pour antibiotics into this tube and they would flood my ear canal and then they would drain it out. I went through this for about a week. I was in the hospital for 3 weeks receiving antibiotics through IV treatment. And to make it worse, if you notice, I know it's kind of hard to see, but the back of my ear is actually flat because the MRSA had actually traveled to my skull and started to affect the bone in my skull. So they had to shave down all the bacteria from my skull. And that's another reason they started to drain this or flood this tube with antibiotics. They gave me about a 38% chance of survival rate, but if I didn't do the surgery, it was a 0% chance of survival rate. So I'm here today sharing my experience with MRSA and Staphylococcus aureus. Now, is there ways to prevent this? Well, the theory is they couldn't see that I had any outer ear infection. And usually when you touch something and you put it into your ear, you develop an outer ear and a middle ear infection. So what they believe happened to me is that little drop of water must have had Staphylococcus aureus. Now the issue is Staphylococcus aureus doesn't survive very long in water. It survives about a minute or so. So that means whoever was before me on that water ride had Staphylococcus. As the water came and swooped up, it picked up the Staphylococcus and then shipped it right into my middle ear. So just very, very bad luck. Now, to prevent Staphylococcus, we always encourage people to wash their hands regularly, disinfect any surfaces, limit skin exposure from using somebody else's towels or razors. And of course, always taking care of any wound. Any open wound will always have an increased chance of Staphylococcus. So I do hope you kind of enjoyed my story and my experience with Staphylococcus. And I just wanted to give you guys a different perspective that not all Staphylococcus aureus are going to be treated easily with antibiotics. That's not always the case. In rare cases, it can happen where you have that one strain of bacteria that's MRSA and can cause a lot of havoc and can even be deadly, because I just missed sepsis by a couple of days. If not, I wouldn't be here today. But if you have any questions for me, please don't hesitate to ask, and I thank you for your time.